Hi there, I'm Dr. Salajegheh. I'm one of the pain management specialists here at Ortho Virginia. It's my pleasure to welcome you to our Facebook Live event from our Lynchburg office. If you don't know, Ortho Virginia is the largest multi-specialty orthopedic practice in the state of Virginia, and we have offices that are located in Lynchburg, Forest, Southwest Virginia, Northern Virginia, Richmond, and Virginia Beach. If you want further information about Ortho Virginia, you can go to our website, www.orthovirginia.com. But that's enough about us. Let's talk about you guys. So today I'm going to be talking about low back pain, how to prevent it, how to care for it, and when to see a specialist. If you have any friends or family members who are experiencing low back pain and you think they'd be interested in our topic today, please take a minute to share this live event. Just click the share button below. So we're going to jump into talking about the chronic low back pain. So as you probably know, low back pain is fairly universal. It affects pretty much everybody at some point in their lifetime. And in fact, 80% of people will have an episode, 80% or more of people will have at least one episode of severe low back pain in their lifetime. Now, temporarily, this can be divided into acute or chronic. And so what that means is chronic low back pain or chronic pain in general is pain lasting longer than 3 to 6 months, depending on the source that you're looking at. Whereas acute is just less than that time. There are several potential causes of low back pain, which we'll touch on in a bit. But because there are several potential causes and the causes are variable and sometimes you can have overlapping causes, trying to figure out the source of the pain can sometimes be difficult, especially if it reaches the chronic state. So how common is it? Now, we talked about that 80% of number experiencing severe back pain at least once in their life. Up to 25% or 1 in 4 people will experience chronic low back pain, which is pain, as I mentioned before, lasting longer than 3 to 6 months. And so that means that if you're in a room with at least 4 people, it's highly likely that at least one of you is experiencing chronic low back pain as we speak. And so 8% of people can experience severe chronic low back pain, and that can be debilitating. And in fact, low back pain is the leading cause of disability worldwide and is getting worse, with those numbers steadily going up since the early 90s. And so what are some risk factors for developing chronic low back pain? Well, number one at the top of the list is age. So just as with any joint or bony structure or muscular structure in the body, as we age, those things tend to degenerate, okay? Now, that doesn't mean that as you're getting older, it's a sure thing that you're going to develop this, because number 2 on the list is genetics, okay? And so some people, despite their age, seem to just maintain good, disc health and joint health and just don't develop those things, whereas others do even at a younger age. It just kind of depends on your genetics, unfortunately. Things that you can control: smoking. So smoking significantly accelerates degeneration of your discs, degeneration of your joints. It can cause worsening osteoporosis, and that's because smoking robs your tissues of the oxygen that they need to sort of stay healthy. There's also work or environmental factors. So somebody who does sort of higher risk sports, or somebody who works on a job where they're doing a lot of bending and twisting with poor mechanics can accelerate their degeneration of their low back, which can lead to these pain syndromes. But also people who sit at desk jobs with poor ergonomics, who aren't taking time to stand up and move around and stretch their back. That's actually also been proven to be almost as bad as somebody who's who has poor mechanics while bending or twisting or lifting at work. So fitness and obesity are kind of important factors as well. So somebody who may have some of these things like poor discs and arthritis in their back, but has good core strength because they're staying active, is less likely to have low back pain, whereas somebody who's deconditioned is more likely to have that. Also, obesity, as you can imagine, putting greater weight on these joints and all these discs stresses them further, which then leads to accelerated arthritis and also greater pain perception. And speaking of pain perception, psychological health is extremely important to managing someone's pain. And the reason for that is, and many people don't know this, is that 70% of the centers in your brain that are responsible for the processing, the management, and the interpretation of pain signaling are also redundant, which means they also do emotional processing. And so, something that I tell my patients is that let's say that you had just won the Powerball today and someone comes in and punches you in the arm. Imagine what that would feel like versus you just lost somebody who's very dear to you and somebody comes and punches you in the arm. It's going to be a very different pain experience, and that translates to chronic pain just as well. So when should you see a doctor? So if you have pain radiating down into your legs, if you've got weakness in your legs, if you have pins and needles sensation, sort of like your leg or foot is falling asleep, or if you have numbness in your legs or feet, if the pain is interfering significantly enough that it sort of inhibits your ability to do your day-to-day activities, those are all things to make an appointment with a doctor or a specialist to get this evaluated. Now, if you have sudden onset significant weakness in your lower extremities, in your legs or your feet, or you have sudden onset loss of control of your bowel or bladder, that's a 911 go to the emergency room kind of event. So there are a lot of different causes, as we mentioned before, of low back pain and specifically chronic low back pain. And so we're going to touch on a few of them here. And so essentially you have to understand the anatomy of the spine to understand what the potential causes of low back pain are. And so we'll start with, we have our anterior elements, which is basically the elements at the front of your spine, which is your vertebral bodies and your discs. And then you have your posterior elements, which are your lamina and your spinous processes and your facet joints. Okay, and those are the joints that articulate when you move around. And in between there, depending on the level of your spinal cord's there, nerves that descend from your spinal cord there, nerves that exit from your spinal cord are there. And so that's in between the anterior and the posterior elements. So the elements in the front and the elements in the back of your spine. And so you can have pain as a result of the discs as they degenerate or whether they bulge or protrude. Discs have their own nerve fibers, and you can have pain that results when those nerve fibers are excited or disrupted. You can also have facetogenic pain, and so that's the facet joints that we talked about as part of the posterior elements, those joints that articulate with each other. Just as with any joints in your body, whether they're in your hands or they're in your shoulders or your knees or your elbows or your hips, those joints can develop arthritis over time. And so as they break down, they can send pain signals as well. Also, as joints break down and develop arthritis, your body's natural reaction is to overproduce bone at that joint. And so those joints can grow or hypertrophy. And when they hypertrophy, they can cause impingement of nerve roots that exit out of the spine and come down into your legs or your back. You can also have nerve root compression that's due to loss of disc height, where the hole where those nerves are exiting can also get impinged because those discs don't have as much space between them anymore. You can also have nerve root impingement again from a disc that's bulging out and pushing up against that nerve. You can have pain that's called sacroiliac pain, and that's essentially pain that's as a result of inflammation or dysfunction in the joint that's between the base of your spine and your pelvis, essentially, and that's common in pregnancy. You can also have myofascial pain, which is pain of the muscles and the ligaments, and that can be due to a strain, or that can be due to a sprain or a tear or overuse. You can have inflammatory processes, and that's autoimmune processes. That can include autoimmune processes such as ankylosing spondylitis or rheumatoid arthritis. And then we can have stressed anatomic elements, okay? And so those are things like those joints are overstressed or those discs are overstressed, again, because of obesity, pregnancy, bad posture. And then there's other non-musculoskeletal causes for pain. That includes things like kidney stones or endometriosis or stress or other environmental factors. So what do we do to treat this? Well, there's a lot of different ways to treat this, and essentially we go from a less aggressive to a more aggressive paradigm. And so oftentimes people can get better with the less aggressive stuff. So the natural reaction is to dismiss it because people think, well, I want something that's going to be done that's going to fix me now. And unfortunately, that's not the way to correct chronic back pain, and usually fails if we have that approach. So it's an approach that kind of where you have to combine multiple elements to lead to successful care and appropriate management of chronic pain. And so we start with things like basic medications like non-steroidal anti-inflammatories, muscle relaxants, and nerve pain type medications, along with physical therapy, heat and ice, massage therapy, and transcutaneous electrical nerve stimulation. You can also go to see a chiropractor. It's important to learn better back hygiene and to adjust or correct those environmental factors that are leading to having these back pain issues. If those things aren't working, then we step forward to things like injections and nerve ablations, and that's putting steroid around the irritated nerves, or that's using nerve ablation needles to disrupt the nerves that are sending pain signals to your brain from those joints that you can't correct. To things where if there's an anatomic cause, like a nerve impingement due to a disc bulge, where surgery can correct it. But we try to avoid surgery where possible. You can do additional things like weight loss where appropriate. And then oftentimes, with time, these things can get better as long as we're correcting things that are causing them. We can also do other advanced things where if a nerve is no longer impinged but the pain is persisting, and we've tried all these conservative treatments, we can try things like spinal cord stimulator technology, neuromodulation to try to help address the pain signaling that's coming from those areas. So if we had to run down some basic tips, essentially, number one at the top of the list in terms of things that you can sort of correct in your life: stop smoking. Let the oxygen get delivered to the tissues that need them so they don't break down, so that they can heal quicker. Stay active. It turns out that being active helps to, like we discussed earlier, helps to prevent the onset and progression of these degenerative processes. Core strength. So even if these degenerative processes have already occurred, maintaining core strength helps to mitigate the pain that comes from this. And oftentimes people who have good core strength, despite having these diseases, won't have any significant pain. And then other environmental factors. So how old is your mattress? How old is that desk chair? Or is your desk set up appropriately so that you don't have poor posture? Is that monitor at eye level? Are you sitting straight? And so ultimately, you're the most important part of your care team, because these are changes that you can make. But we at Ortho Virginia are here to help guide you through that. Now, the causes of back pain, as we discussed in our talk today, are multifactorial. There's a lot of different potential causes. A lot of them can overlap. And so, as mentioned before, it can be difficult to elucidate what the cause of that is. With acute onset back pain, so the short-term back pain, most of the time that gets better. But about 20% of the time that progresses to chronic back pain, and that becomes a little bit more difficult to treat. Ultimately, you need to take charge of your own health, and you need to modify your environment and maximize your own spine health, and that is the key to prevention and treatment. And so, as I mentioned before, we at Ortho Virginia are here to help. So I hope that this information has been helpful for you. Now let's get to your questions.
All right, our first question is, I drive for a living and my lower back is always bothering me. What do you suggest?
Okay, so driving, again, so we talked about some of those environmental factors. So you have to make sure that the seat that's in the vehicle that you're driving is right for you. And if it's not right, you can make modifications to try to sort of improve that, whether that's adding additional padding, putting memory foam padding underneath your buttocks or behind your back, using heat. Making sure that you're taking breaks to get out and stretch and rotate your back around a little bit. And also, as we mentioned before, when you're not driving, work on your core strength and work on your posture, and that may help. And ultimately, if that doesn't help and it's due to some joint issue, there's procedures that we can do to help.
Okay. When I have low back pain, why do I also feel pain in my hips or knees?
Okay, so if you have low back pain, those facet joints that we talked about in your low back can actually cause what we call referred pain to your hips and knees. So those may be the culprit. Now, if that pain is radiating all the way down into your legs, or even if it isn't, it can also be due to nerve roots being impinged. And so those are things that we can sort of figure out by talking to you in a visit or by getting some advanced imaging like an MRI to see what exactly is going on in your back. But those are two potential causes.
Running bothers my lower back, but I don't feel comfortable in a gym right now. Are there any exercises or types of cardio you recommend for someone with back pain?
So if you happen to have a private pool available at home, which many of us do not, then that's a great option because it's a high resistance environment with the water, but it's low impact, so it doesn't bother your joints as much. You can do biking. I wouldn't necessarily recommend rowing unless you're really on top of things with your posture. And as far as the pain caused by running, try running in an environment where there's less impact. And so instead of running on pavement, try running in grass or on dirt, or try adjusting your running shoes and seeing if that makes a difference for you.
So we did have another question asking if swimming will help arthritis and back pain.
Swimming is a great idea, and like I said, it's a low impact environment. So when you're done, outside of some muscular soreness from the actual exercise, you shouldn't have significantly worsening joint pain, and it's high resistance, so you build the strength that you need.
What should I look for in a new mattress?
And so that is variable. I can't give you a specific answer in terms of what your body reacts to the best. I wish that I could, and that may be a field of medicine coming forth in the future. But so some people do better with firm mattresses, and others do better with softer mattresses. I would say in the majority of cases for people who have back problems, firmer is better. But that's there are certainly several exceptions to that rule.
Another sleeping question: is sleeping in the fetal position good for back pain?
So that's a difficult question to answer. It's if it works for you, then the answer is yes. There's certainly no reason not to sleep in the fetal position if you think if that helps. It's not gonna. It's unlikely to lead to further degeneration or worsening of pain. And if it helps you, more power to you.
Why is my back pain worse when I'm lying down as opposed to standing or walking?
So it depends on the environment that you're laying down in. So again, if we're on a mattress that doesn't give you a lot of support, or on a couch that doesn't give you a lot of back support, or that's a little bit too soft, it can again stress those joints and those discs in your back, which may already be inflamed. As we mentioned before, activity sometimes, so let's say for example you wake up in the morning, your back is feeling painful and stiff, and then you find that as you get moving, things start to improve, and that's simply because we're getting blood flow to those areas, we're getting to wash out some of those inflammatory factors, and things start to settle down. So if it's a persistent issue for you, try to evaluate the surfaces on which you are laying down. And if it's still persisting despite modifying those surfaces, try to get into some physical therapy to strengthen that core up a little bit.
Right, another sleep position question asked about why does using a pillow between my knees help with my back pain? Without using it, the pain is excruciating.
Yeah, and that's a very common question. It's actually a recommendation we make to a lot of our patients. If you have a pillow between your knees, it keeps your legs at kind of a neutral position, which then doesn't pull your pelvis down into a stressed position. So if you imagine the legs coming together, it's pulling at the base of your pelvis a little bit, and so that can stress your SI joints, and that can actually stress your facet joints. So if we're putting a pillow between them and keeping them neutral, those joints are staying unstressed.
Do you recommend turmeric for joint pain or something else? I guess maybe something else natural like turmeric.
Yeah, so there isn't a significant amount of well done scientific evidence to suggest that things like turmeric help. There's evidence to suggest that it may help. Now, turmeric for the most part is a pretty benign substance. So if it works for you, the idea behind turmeric is that it acts as an anti-inflammatory. So if it works for you, then certainly it's reasonable to try, and you can continue to take it. Now, there's a whole host of things that you can do from a diet standpoint that to adjust how much pain you're having and how much inflammation you're having, and I suggest those of you who are interested in it to look up the anti-inflammatory diet. So reducing all of the different substances in your diet that help to promote inflammation as a whole, as opposed to just adding one, can often be more successful.
Can you offer a couple of core strength exercises other than the pool or biking that might help lower back pain?
So the idea behind, now I'm not a physical therapist, but I'll tell you what I know. The idea behind doing core strengthening exercises is you want to strengthen the core without stressing those joints and those discs. And so you don't want to do something where you're doing a lot of bending or twisting, at least at first, and probably honestly long term as well. And so you want to do things where that low back is staying pretty static. And so ideally, you're doing something like crunches where your back is staying flat on the ground, but you're raising the top of your body to activate those upper abdominal muscles. Or you can do leg raises where, again, your back is staying flat on the ground and you're raising your legs up about 6 inches to a foot and holding it there. And then eventually you can do swimming moves with those legs and moving them up and down. And then as you do those and you find your core strength is getting better, you can graduate to planks. But only do planks if you can do them with good posture, because again, that can stress the joints and the discs in your back. But those are a few options for you.
All right, someone said, some yoga poses seem to aggravate my pain. Should I work through this to strengthen those areas?
So, I'm not familiar with a lot of the yoga poses. I would say that if it's aggravating your pain and it's staying aggravated for a period of time afterwards, then that is your body telling you to avoid doing those poses. Certainly, strengthening elements to sort of get you through those poses is an option. And if you have a physical therapist or a personal trainer who can help identify the areas of weakness and strengthen them, and then you can come back and revisit those poses in the future. But if it's giving you a sustained aggravation of your back, for now, avoid it until you get them stronger.
Someone said, I get low back pain when I walk for 30 minutes each day. I guess the question would be, should they decrease that activity or continuing with that activity to help?
So if you are walking for 30 minutes and you're getting low back pain, there's a couple of things that kind of dictate what the next step should be. If you're having leg pain along with that low back pain and it's getting worse the longer you walk, then you should get evaluated by a specialist. If you're having the low back pain with just the walking, we want you to stay active. 30 minutes of walking shouldn't be your limit. I think the next step is to get you in to see a physical therapist to strengthen those muscles, to strengthen that core, and see if we can prolong how long you're walking without pain. And then if that's still not working, then we need to make additional modifications, and it's worth seeing a doctor about.
I broke my T11, T12 over the winter and now have pain that radiates down the front of my body. I also have an immediacy to bowel movement and urination. Could this be helped with a shot?
So, and when did we say that the break occurred? Okay. So if we have compression fractures, which is what I'm assuming you had, early on in the life of compression fracture, when they're still kind of acute, we can try to correct the fracture by going into the vertebral body and injecting it with cement and ballooning it back open, and that restores the height of those vertebral bodies, and that can help to reduce the nerve pain that you're having and the back pain that you're having. At this point, I'd have to take a look at your imaging and evaluate you in clinic to give you a better answer in terms of whether a shot would help or not. If there's disc bulges associated with it that's causing irritation of nerves, then potentially, yeah.
This person says, I have scoliosis in my lower back and have been diagnosed with AS. I don't know if you're familiar with that. We need maybe them to...
AS as in aortic stenosis? Heart condition? Ankylosing spondylitis?
We can see if they reply back.
Okay.
So we'll come back to that question. Let's see. Anything short of laminectomy surgery for chronic spinal stenosis, and how effective is that surgery?
So back surgery, and many spine surgeons will tell you this, is most effective at treating leg pain that's associated with irritation of those nerves due to stenosis or due to disc bulges or various other conditions. Back surgery for just back pain is variable. Now, if you've got severe stenosis, I can't give you a percentage in terms of what the likelihood that it's going to get better if it's just back pain. But there are other, less invasive procedures that we can visit depending on what the cause of the stenosis is. And again, that's something where you'd have to have a sit-down conversation to evaluate what we see on the MRI and make a decision based on that.
I feel pain in my groin area. Could that be from my hip or I guess also from back?
So yes, pain in the groin area can be from the hip joint itself. It can be from the sacroiliac joint, which is that joint between the base of your spine and your pelvis, because that extends over to the front as well. It can be due to nerve root impingement at higher levels, kind of like the L2, L3 levels. So if you guys have the time and want to Google dermatome map, you'll be able to see what I'm talking about. And rarely you can have referred facet pain into what feels like that groin area as well.
Can the fusion from back surgery be the cause of lower back pain?
That's a difficult question to answer. I think the answer is I don't know. Have I seen patients who have had fusion operations who then have, let's say they had it for primarily leg pain, and then they have a fusion, and then they come back afterwards, and their leg pain's better, but now they've got back pain. So I've seen that sort of thing occur, and certainly it is a risk of the surgery. In terms of how it causes it, it's probably due to biomechanical mechanisms where levels that traditionally should be bending and naturally had been bending in the past or twisting are no longer able to do that. And so you stress the elements above and you stress the elements below the fusion a little bit. And so, yes, I mean, in that sense, it can cause back pain. And so some of the treatments to help try to correct that is, again, core strengthening. And, I keep hammering that home, and I'm sure you guys are tired of hearing it, but it is very important.
What is the best over-the-counter medications for everyday low back pain, and how much or how often should they be taken?
So that depends on what your past medical history is, whether you have kidney disease, liver disease, GI issues, whether you've had a gastric bypass, whether you have inflammatory bowel disease. There's a whole host of different factors. So always consult with your doctor first before taking these medications regularly. But in general, acetaminophen or Tylenol is a decent drug to use over the counter. It's pretty safe to use. You'll have some liver toxicity if you overdose on it, but otherwise it doesn't cause a lot of stomach issues. The downside to it is that it doesn't have a real impact on inflammation. And you can take 1,000 milligrams of that if you're healthy otherwise, up to 3 times a day. You can also do anti-inflammatories like ibuprofen, which is often known as Advil or Motrin, or naproxen, which is often known as Aleve. And with the ibuprofen, depending on your size and weight, you can take between 200 and 600 milligrams up to 4 times a day or every 6 hours or so. And the naproxen, you can take between 220 and 440 milligrams twice a day. Always take these with food if you're taking the anti-inflammatories like ibuprofen and naproxen. Know that they do increase your risk of kidney injury, liver injury, GI ulcer, bleed, and increase your risk of heart attack and stroke as well, though very, very, very small increase in risk. And those are useful because they have an anti-inflammatory action, so they can actually treat the root cause of what's happening. And then you can do topical things, and so those are things like menthol creams, lidocaine creams and patches. You can use over-the-counter transcutaneous electrical nerve stimulation or TENS patches. And yeah, that's about it. That's a basic run through.
Okay. So just sort of a general question, someone with lower back pain, what should be their first step? How is low back pain evaluated and diagnosed?
So low back pain is essentially diagnosed based on what you tell us. So if you come in, you say, I've had low back pain for the last 6 months, then you've got chronic low back pain, right? But in terms of how it's evaluated, we put you through some physical exam efforts to try to pinpoint what the cause of it is. We have certain types of physical examination maneuvers that we can do that light up with certain conditions. We would also do some basic imaging like an x-ray to see if there's any more concerning issues that are going on in terms of whether you have a fracture or dislocation or anything like that. And then we treat it conservatively, like I discussed at first. And if we're not getting the results that we're looking for at that point, then we get a little bit more aggressive with the imaging, and we get an MRI, which can show us some of the soft tissue stuff that's going on. So that's nerves and discs and things of that sort.
I have been told I have arthritis in my SI joints. My low back pain has been getting worse despite physical therapy over the past year. What should my next step be?
So if the cause of the pain is the arthritis in the SI joint, something I want to make clear is we have patients who come in who have the worst discs and the worst joints as far as arthritis, and they've got narrowing and they've got low back pain that's as a result of I'm sorry, they don't have low back pain. They've got arthritis in their SI joints, and they're there, for example, for ankle pain due to an ankle injury, and they have no low back pain. And so having the imaging diagnosis of degenerative disc disease or arthritis doesn't necessarily mean that you're going to have the pain as a result of it. And so if you're having the pain and you have arthritis in the SI joint and your physical exam and your description indicates that it's probably from the SI joint, then something that we can do is to try to reduce the inflammation that's occurring in that SI joint. So we can go in under x-ray guidance and we can put some steroid and numbing medicine into that joint to try to calm down the inflammation to treat your pain. And that can sometimes lead to better therapy thereafter because you're better able to participate in it, and the strengthening results in long-term relief of the pain. If that doesn't help, then we can actually burn or ablate the nerves that go to that joint to help reduce the signaling that goes to your brain that says that joint hurts. But there's not actually a fix for arthritis. If you have instability in that joint, there's actually joint fusion procedures that we can do as well.
I have stiffness in my back, but severe shin and ankle pain at the top of my ankle. What do you recommend to relieve the pain? Are there any exercises?
Again, a physical therapist would better be able to answer those questions for you. Some of the exercises that I discussed before for core strengthening, if this is pain that's due to the nerve roots in your back, or even the facet joints in your back, or even the discs in your back, then those exercises that I talked about can be helpful. In terms of exercises further beyond that, that's something that you'd have to talk to a physical therapist about. Sometimes when we have pain, we don't move around as much as we should. Our legs get weak. When our legs get weak, it adjusts the biomechanics of how we walk, our gait essentially. And so strengthening of your legs and your gluteal muscles becomes extremely important to managing that as well.
Does using orthotics in your shoes help with back pain?
Yeah, the answer is yes, potentially it can. And so it sort of depends on the biomechanics of your foot, areas that are causing pain. But yes, there are orthotics and there's certain types of shoes that can adjust how you stand, or that can sort of match your lifestyle. So if you're in an environment where you're standing all the time, it can adjust those biomechanics to help reduce the level of stress that gets transmitted to your back. So yes, that is a possibility.
2 years ago, I had steroid shots because of a herniated disc. I now feel fine. Do I feel fine because the shot is still working?
So no, the shot, the way that steroid injections work is you put steroid around a nerve or a disc or in a canal where there's inflammation, and then the steroid significantly reduces the inflammation that's occurring. So that's what helped to reduce your pain. Now, as I mentioned before, you can have that disc bulge, and despite having that disc bulge, you could have no pain. And so if we've reduced the inflammation that occurred and there's nothing that's there to reignite that inflammation, then yes, you're going to have sustained relief, even though the steroid itself is not still actively working. And then the other circumstance is these things can heal on their own, as I mentioned over time. As I mentioned previously, these can heal on their own over time. And so when you had the steroid injection, it helped to reduce the pain, and then it stayed reduced long enough for things to just heal, and you just haven't had a problem since.
Can you speak to TENS units and also dry needling and how they help with low back pain?
So TENS units, the idea behind it, it's called transcutaneous electrical nerve stimulation, but oftentimes we use it on muscles. And the idea behind it is the gate theory of pain. And so that's the basic concept of how we think it works. And so you can Google that if you'd like, but basically the idea behind it is we fill the nerves that are going into your spinal cord and then up to your brain with enough other signals that there's no room for those pain signals to be sent. So that stimulation, that the electrical stimulation that the TENS unit is providing is essentially pushing out the pain signals. Dry needling, the way that it works is that actually you target what are called trigger points, which are focal areas of muscle spasm or where muscles are irritated. And there's a couple theories in terms of how it works. The first theory is you're getting mechanical disruption of a spasm reflex arc. And so you're mechanically disrupting a muscle spasm, kind of like a deep tissue massage would, but think of it as a really deep tissue massage because you're using needles. And then the other way that it works is if there's a low-grade injury that your body just isn't healing within that muscle, the idea is that you go in and with a needle you cause a little bit of additional muscular injury, right? Because you're using a needle, and so that actually helps to increase blood flow and recruit healing processes. But that's a controversial mechanism.
All right, so this will be our last question, and then we'll wrap up. Can my diet cause or elevate lower back pain? I've heard that some foods can help fight inflammation while others can lead to greater pain.
So, to answer your question from my own opinion, I do believe that diet plays a very important role in modulating whole body inflammation and pain. So yes, the answer is I believe that diet can make an impact on inflammation and pain, and modifying that can help to correct that or reduce inflammation and pain. In terms of actually, utilizing randomized control trials to evaluate these things, which is sort of the standard of what we look at in medicine, to say, yes, there's evidence for it. There's not a lot of formal scientific evidence for it, but there's a lot of anecdotal evidence, and oftentimes it's safe to do so. And so if it works, then go for it, and I strongly encourage it.
Okay. Go ahead and...
All right. So again, thank you for joining us today. I hope this was useful for you. If you have any additional questions, please go ahead and post in the comments, and we'll try to get back to you with it. If you want additional information about what we do here at Ortho Virginia, please visit our website, www.orthovirginia.com. Stay safe, wear your mask, be sure to wash your hands, and take care of your mattress and your chair and maintain that core strength. All right. Thank you for your time.
All right, and just so everyone knows, a recorded version of this session will also be posted on our Facebook page, so you can come back to view it if you tuned in late, or if you want to continue to share it with someone who might be able to use this information. And thank you for joining us today.